Member of the panel.
Deputy Lucy Stevenson, member of the panel.
I'm Karen Jensen-Stone, Councillor St Martin, a member of the panel.
And Minister, welcome to the hearing. Could you introduce yourself and your officers, please?
Thank you. I am Deputy Lyndsey Feltham. I am the Minister for Social Security.
Suda Hamill, Associate Director, Cabinet Office.
Sophie Laswer, Chief Officer for Employment, Social Security and Housing.
And Andy Hackwell, Group Director of Strategic Finance from the Treasury.
Thank you, everybody, for making time to attend the hearing today. So we have quite a lot of questions, and we've got a bit more time than usual for this hearing. We've got 2 hours, so we will try to, hopefully we'll be able to fit in all of our questions. Minister, the budget that has been presented to the Assembly for your part of the budget, but also for the discussions in terms of the wider budget around the Council of Ministers table. Could you outline how your approach has covered inequalities and inequities in our society, and how your part of the budget and the budget more widely addresses these?
So obviously, firstly, I was very aware of the financial constraints that we're facing now. Obviously, my department has its role to play in being as efficient as possible. To answer, and I'm confident that the Chief Officer plays her part in the executive leadership team on that. With regard to some of the issues that I wanted to address through the budget, I was very aware of issues that had been brought to me in relation to child poverty in particular. I think we've spoken before about the pressures that we know families face, particularly at the start of the school year. So I wanted to ensure that we had something within the budget that enabled me to help with payments related to that coming into the school year. We're also very conscious of the cliff edge that happens when people are eligible for income support or not eligible for income support and other benefits. So smoothing out some cliff edges was also one of the things that was a priority for me, which is why there's money in the budget to expand Pension Plus to more pensioners that would currently not be eligible for that. Also, one of the areas, and we recently had the report out about progress on the disability strategy. I wanted us to be able to make quicker progress on our disability and inclusion initiatives. So that was another area that I wanted to see further funding available in my space. Obviously, I've also got a role to play within the Council of Ministers in supporting other ministers with regard to equity as well. So I was pleased to see that we've got funding for childcare provision. That is really important, and I'm sure that your sub-panel will have some focus on that as well. So I think as we look to that, it is really important that whatever we do, we think about equality. Obviously, very conscious around health budgets and the pressures on the health budgets, and enabling the health minister as well to meet the needs there.
Did you take a gender-sensitive approach to your budgeting?
I personally would take a gender-sensitive approach. I don't think it's built into the process. But
what could we do to build that into the budgeting process?
I think that's an interesting question, actually. And perhaps that's part of the role of scrutiny as well, is checking that we have been sensitive to equity and inclusion as well. I think having women around the table of the Council of Ministers, obviously we can bring that perspective.
But you think it's something that should be built in at the beginning stages rather than the scrutiny stages?
I think, and we've spoken about this before, the need to ensure that policies as equitable as possible and thinking through the ramifications of policy. Obviously, the things that we've got funding for in the budget still need to be scoped out. So I'm quite happy to take on board what you're asking me to do and think through that as we scope out the measures that I've got the funding for, if that funding is approved by the Assembly.
Sure. Okay, thank you. So we have had a look at the business cases and some of the funding that has been allocated in your department. And there is a line called Supporting Islanders Strengthening Communities that the panel is very interested in. So we're going to start by asking some questions on the helping struggling parents with the cost of the new school year. Deputy Stevenson will take these.
Thank you. What amount is set aside for that project? How many families are you aiming it at, and on what criteria is access being granted? Yes.
So I'm conscious that what we have at the moment is the overarching budget. If that's approved, then the department will continue to do scoping work on that. We have a project start. It's one of those where you need to have the budget to kind of justify the work. My instruction to the department so far has been it should be targeted at lower income families, not necessarily just families that are in receipt of income support. We also know that, for example, we are concerned that pupil premium may not be being taken up by all of the families that are eligible for it. So one of the ways that we are intending to scope out these payments is to also link it to pupil premium to encourage people to access that help as well. Sophie, have you got anything to add from the departmental
Can I just ask a bit more detail about pupil premium? Isn't that something that is delivered through the school? It's not something that goes to families directly?
Yes, it is, but of course there's an application process. So when I met with a head teacher at one of the secondary schools, they were very conscious that perhaps pupils weren't or the families weren't receiving help that they were eligible for.
But it wouldn't help with cost of living though, would it? Because mine, and I might be wrong, but isn't pupil premium things that are delivered in the school environment?
Absolutely, but that then helps the school to deliver the right services to the pupils that need it. But enabling the schools to access that funding is really important. I can see Sue wants to.
Yes, the Minister's point is that so there are two things, but they come together quite nicely. So number one is delivering a cash benefit to parents before the beginning of the school year, yeah, and making that benefit accessible to people across without any kind of normal restrictions on 5 years or income support, stuff like that, yeah. So a broadly based support, yeah. And the point is that when people access that who are not got 5 years residency, we could signpost them to applying for pupil premium, or even get them onto pupil premium automatically or something like that. And we haven't worked out the details yet. It's that way around though. So the point is to make sure that schools have got the funding that they are entitled to have for the pupils who might need extra help because they're coming from low-income families. Yeah, if you are under 5 years, you can apply for pupil premium, but very few people do because there's nothing in it for them directly. It doesn't give them any cash. It is about the education of the child, and it's just one more form to fill in. So we don't believe there's not a strong enough motivation or kind of contact. Yeah. So although this benefit wasn't designed to do that, that might be a useful byproduct, if you like, yeah. But we are still, the Minister hasn't, we've got very broad, high-level plan at the minute. We will develop this as once the funding's in place and the allocation of the individual bits are sorted out in more detail.
Yeah, I'm also obviously happy to take comments from other states members and Scrutiny around, targeting, because I know that's something that you feel strongly around is child poverty. So this is something that I would hope will ease some of the burden on families. We know it's a critical time period, and we want children to be able to start the school year with the equipment and the uniform that they need, because that is part of dignity, isn't it, as well? So that's why that was particularly important to me.
So acknowledging that there's still some work to do on it, there will be an outline business case that puts it together. How much of the 1.8 million for next year that I think is set aside for these 4 projects is are you aiming to spend on that school, back to school part?
So at the moment, with the programme, we've got the funding for those components of the programme. As we develop the each of those initiatives, we'll be allocating that budget within the department. Sophie, have you got some kind of high-level figures at the moment?
Yeah, we do still need to flesh it out, but I suppose an initial look at, well, like, what might the cohort be for this if we've looked at and, you know, we're talking sort of between 1,500 and 2,000 probably primary school age pupils. We've sort of made an assumption of a target group, and around 2,000 secondary school pupils. So we think we're between the 3,500, 4,000 potential applicants for that. We need to do some work over on what would the right amount be. Would it be the same amount for primary and a secondary, or actually is there slightly more expenses that come with the start of a secondary school year than a primary school year? But at this stage, that's the sort of numbers we've kind of looked at. And I suppose, yeah, within the overall Cisco project covering the 4 different strands, we're sort of comfortable within that we should have enough to be, but we need to kind of, we're not going to say a sort of definitive, it's exactly a quarter per project at this stage, but we've done some broad assumptions looking at, well, what sort of target group do we think it's likely to be, but we really want to just make sure we look in detail at what's, you know, what would the right amount be and what would that split be.
And how much are you hoping to be able to give families? Do you know that?
That is what we're going, because we need to balance off the budget that we've got within the budget with the number of families that we want to help.
Yeah.
And like Sophie said, there's some scoping work to be done on the department, from the department level on what's the right amount to give for a secondary school and primary school. So the important thing is that we get the money in the budget, the money agreed in the budget, so that then we can actually know that we can undertake that work with certainty. As a former project manager within government, I will absolutely ensure that the correct processes and procedures, Sophie knows and Andy know, I think, that I'm really keen to ensure that we've always got the correct business cases and paperwork and documentation done. But this is very much in scoping phase at the moment. I think we're very clear with our intention. I'm hoping that the Assembly will support that budget so that we can meet that intention and get funding out to families.
I suppose the comment I would just add to that is that ensuring also that stakes members have enough information to be able to make a reasoned, informed decision as well about it, about whether they're okay to put their name to that would just be my feedback on that.
Can I just follow up on that?
Of course,
So will there be more detail, as Deputy Stevenson asked, will that detail be ready in time for the budget debate?
My department at the moment is working very hard to implement the projects that it's implementing this year. I could get staff to do that work, whether it's good use of staff time to do the work before the budget's approved is one of those balancing factors. We can get further scoping done so that we're talking about the types of amounts of money, because I think that's what you're concerned around is, you know, how much money is it going to be enough going to a family. So that's the type of work that we can do. What I wouldn't want to do is stand up a whole administration process that may not be then utilised if we don't have the budget approved in the budget.
Thank you for that. What analysis was undertaken to identify that there's need for this service, for this benefit?
It came from direct feedback from key stakeholders such as, like I said, school head teachers, the Children's Commissioner, also when we had discussions in the cost of living group and representations from organisations that support families around what those kind of crunch times are. We obviously have access to income support, and again, like I said, I want to try and smooth out those kind of hard cliff edges to receiving funding. Again, it it was certainly something that I heard loud and clear, that at the end of the school holidays are costly times anyway for families. And then there is that additional stress for families as they're starting that school year. So that seemed to me to be the most appropriate time to be able to give a funding amount to families to try and help.
And how do you intend on distributing the funds? Is it a voucher scheme, a cash benefit, the uniform itself? What's the policy intention at the moment?
I wouldn't be in favour of giving people the uniform itself. I think that there needs to be personal autonomy. That again comes down to the bit about dignity. So I personally don't like the idea of voucher schemes where people are identifying themselves as a low income household. So I would be seeking to make a payment in such a way that the low income households wouldn't have to identify themselves when they are obtaining things like the school uniform and the equipment. That's my personal view.
I think we've got experience of doing cash, sort of just direct to bank account payments. I think that's what, that's from an administrative point of view, that's simpler than getting into voucher situations as well. But also, as the Minister says, it feels like, we know that there's these costs get incurred, but give the autonomy to the individuals of how they, which bits they spend it on. So.
With that in mind then, how do you intend to monitor the success of the project and that the money is being spent on what it's intended for?
Obviously, we will maintain conversations and dialogue with our school head teachers. They're the ones that see it. They're the ones that see children turning up without uniform, without equipment, and having to deal with that on a day-to-day basis. I think parents will want to put their children first. I'm not sure when you're saying, how do we ensure that people spend the money on what it's there for? The money is there to alleviate a financial pressure on families. So that would be where I want to see that heading. Again, we can survey families. We can, get some feedback from them following that. We can do that before as we're scoping out the project. But like I say, the key point at this point in time is making sure that we've got the budget so that the department can actually undertake that work and know that it's undertaking the work that it's going to then be able to implement.
Okay. And we talked obviously about who might access it from kind of a financial level point of view, but do you intend it to be universal for all levels of need, or is there any targeted funding for SEND students, maybe with specialist equipment or anything like that?
That's something that, of course, we could consider. I'm quite happy as well to bring that up within the Disability and Inclusion Advisory Group as well, around whether there's any additional kind of forms of need. That is also why we're kind of packaging this all together as a programme, so that we've got some flexibility within the budget allocation. So we've got the disability and inclusion allocation, so whether that type of thing could come out of that funding or the funding for the families. We want this to all work together and work as efficiently as possible. I think that's my biggest message, because there's lots of talk about waste in government, but I need to know that my department are putting their energies onto things that are going to happen and that the Assembly is supportive of.
Thank you.
I have a couple more on this. So the numbers that you've identified, what kind of parameters are there around those numbers? Are they income support families, or is there another? So you mentioned the 1,500 to 2,000 primary pupils and 2,000 secondary pupils.
I think that was initial scoping, just looking at what are the primary school, what are the actual cohorts.
Yeah, it's a quarter of the total.
Yes.
So on the grounds that you just take, you look at low income statistics and you say roughly about a quarter of families live in low income. So we started, so as the Minister said, it's all very early days yet. Because our very early planning assumption, we just started as saying if we could target the bottom quarter of the income profile, that would work quite well.
Okay, right. And in terms of the targeting, so Minister, you've mentioned child poverty, and I can see that's the thread running through your work and a concern of the panel as well. And you've talked about cliff edges. So with this scheme, how will you ensure that that actually reaches families who are in need, and that does low income always equal the greatest need, or might there be families perhaps where there's disabilities present in the family that actually have a greater need, or an equal need perhaps?
And this is, like I say, I'm quite keen to balance across that budget for this programme so that we are meeting different needs.
Yeah.
As Sue mentioned as well, I'm always very conscious that we've got families that haven't been here for 5 years and don't meet that 5-year limit for income support, that are families in need as well. So it was important to me that those families would be eligible for this payment. Again, I'm aware that that's a cohort of people that the schools are concerned about as well.
Yeah.
So I think that's why I'm really keen to get this budget approved so that we can do some work. And it is around trusting government as well. Part of the reason, say, for the lower than anticipated take-up of the pupil premium may well be because people are afraid or don't want to kind of to apply, and it does come down to that dignity aspect as well. So we need to build up that trust.
Yeah.
And we also need to make people feel comfortable around applying for benefits that they are entitled for.
Yeah, thank you. And have you done any work or any modelling on the cost of buying uniform at retail price, and how much money might go towards cash benefit to allow people to do that, versus the government or the schools themselves having the same amount of money and buying in bulk and potentially being able to just offer the free uniform universally perhaps, or to a far greater number? Has that been considered?
That's not something that I've considered so far. I'm quite happy to take that away and have a conversation with the Minister for Education and Lifelong Learning about that. I know the cost of school uniform is a contentious subject, and whether you can go and buy it on the high street or whether it needs to be branded and things like that. I get that states members will want to see that we're getting as much value for money as possible. I absolutely agree that should be a priority. My focus, of course, is on ensuring that we're trying to ease costs for families and financial burdens as well.
Thank you.
So if uniform could be less expensive, and then they've got more of that payment to be, then because we also know that for example, things during the summer holidays are incredibly expensive.
Yeah.
So there will still be unmet need.
Yeah.
So the more value we can get, the better.
Okay, thank you. Will you let us know the outcome of those discussions with the Education Minister?
Of course, yes.
Thank you. And I have a general question around this line on supporting islanders. And I understand that you said you're still working on exactly how the money will be split up. Are you able to say roughly, is it going to be equal amounts for those kind of 4 projects, or is one weighted to a greater amount than the other?
So like Sophie said, kind of we're more or less equal across the projects, but once the scoping's done, if we find that at the end of the day, this comes about outcomes, doesn't it? So I'm clear about the outcomes that I want to achieve. And then once that's scoped up, it might well be that we need the flexibility within that broader budget to, say, put more money to one area than the other, which is why we've kind of put that under that broader headline.
Okay.
Because I do really want to be outcomes focused.
Thank you. And so it's 1.8 million for the next 3 years, falling to 1.6. What was the reason for that drop in the 4th year?
No, that's, I can
Yes,
do
it
that.
was, yeah.
So the one of the strands of the project as a whole is the pension saver work.
Yeah.
And we think that by 2029, the project will either have kind of come to a kind of close because it won't have been pursued, or it will be actually moving into an operational phase. So to say that developing in that last year won't be sensible, won't be needed for one reason or another. So we don't want to judge what that reason is, but we didn't feel there was a need to put funding into the last year. So there's 3 years of development funding for Jersey Pension Saver, but not the fourth year. And the others are more ongoing things. So they've got 4 years each of those.
I see. Okay, thank you. And in terms of, say, next year, 1.8 million, that was the bid that was approved by Council of Ministers. Minister, what did you originally bid for year on year for this area?
I'm just
That was,
thinking that was
I
yeah.
think we bid 1.8 for all 4 years.
Yes.
And we've just got that last bit.
Okay, and did you have to justify that to the Council of Ministers? Was it an easy win, or did you have to fight for it?
I don't think anything's ever an easy win, is it? But I think, these things, they do go hand in hand with the wanting to ensure that we've got the types of outcomes for islanders. We want to have islanders having a better life. People are concerned around that cliff edge. It's a conversation that I have with ministers quite often. So I think in that sense, it met what other ministers were hoping to achieve in relation.
Was it unanimous?
I can't recall the conversation. I'd need to go back to the minutes, but
Sure. Okay.
there were
Thank you.
lots of discussions around the budget. So as you can imagine, we take
So
that
no opposition
serious.
that you can recall from any particular ministers or departments?
Not that I can recall, no.
Okay, thank you. Those are my general questions. And the next section, Constable Shenton-Stone is going to lead, and it's about the workplace pension.
Yes, thank you. Minister, given that money is being allocated to this project for mandatory workplace pensions within the budget, could you outline why and provide more details on what it will cover?
So I'd obviously paused the work that had started earlier on in my tenure in this role. The reason why I'd paused that at that point in time was because I wanted to prioritise raising the minimum wage. And I didn't want to place the burden, or what might be seen as a burden, on employers at the same time. So I wanted to focus on implementing that. That said, I am very aware that in particularly lower paid workers are more likely to be the ones that are most affected by not having access to a workplace pension. So this is about making it as easy as possible for people to be able to save for the future, and picking up that piece of work again. I think that the timing now is better. What we do need to do is bring people along on the journey with us as well. I think I said at the time when I paused it, I didn't feel like I could ask people to save for their pension if I knew that the wages were such that they couldn't afford a loaf of bread on the table. So that's why I prioritised that first. But we do know that we've got an ageing population. We know that people need to be encouraged. Sometimes, just that auto enrolment into a pension, people then don't think about it. I am also conscious that younger people as well may not be inclined to save for a pension if they're saving up for their first home. So I would like to look in this project around flexibility around whether we enable people to save up for a deposit using the same scheme, for example. So anything that we can do to encourage people to set up that savings, I think is a good thing. There are lots of decisions that will need to be made along the way. There will be political decisions and legislation that will need to be passed. So it's not going to be a simple project. It will be a complex project. We need to think about whether there should be compulsory employer contributions, for example, or not. But again, if we think about what outcome we want out of it, the outcome from my perspective is where currently workplaces will find it too difficult to set up a pension scheme, making it easy, and also making it easy for people to have that option to save. So I did meet informally with my counterpart in Guernsey. I'm obviously interested in how things are going from Guernsey's perspective, because they have implemented their scheme already. So there's things that we can learn from other jurisdictions. So I think that this will be a really valuable piece of work.
Yeah, thank you. I agree with that. But what contingency is in place to support those who do not currently pay into a scheme and may reach old age without any income? As we've said, it's an ageing population. And bearing in mind only about a third of Jersey residents are paying into a workplace pension. Is there a contingency in place to support those who don't currently pay in, or is it just the basic?
So I think it's really important to get it across that if somebody is just receiving basic pension as their sole source of income, they would be then eligible for income support, and that's where our safety net is for all low-income islanders. So that is how we operate things at the moment.
Can I just ask the supplementary, is that the case if they own their home?
Yes, so that the components, they would be eligible for a small amount towards the cost of the home. Obviously, that's not the same amount as the rental component, but all of the other components, if they meet the if they don't meet the threshold, they would be entitled to.
Is it a standard amount? Can you say how much it is?
It depends on the household. So
I mean, for pensioners who own their home and are just drawing on a state pension,
we could provide that calculation.
isn't it? My understanding was it was a very small amount, about £10. Is that?
Okay, so there's the Minister's describing the way that we do accommodation components and income support. So accommodation and income support, there are basically three types. If you're in social housing, the full amount of the rent is included automatically if you're kind of appropriately occupying the property. If you're in private rented housing, we support rent up to a cap, yeah? And if you're in owner-occupied property, then there's a much smaller amount. So the first two are hundreds of pounds a week, yeah? And the third one, which is an owner-occupier, is about paying for building insurance, the kind of expenses that are incurred by an owner of property. So it's principally around building insurance, yeah? So they are £10 to £20 a week. They're much smaller amounts of money, yeah?
Understood.
It's important to remember that that's just one component.
That's yes. So that's that. But the amount of income support that you'll get as a household is dependent on a whole variety of things. How many people live in the household, their income, their personal care needs, so their disability, a range of different things like that. Yeah. So you'd have to do an individual calculation for an individual person.
Sure.
If
We
I could
could
just
provide some
Thank you.
scenarios, I'm sure, if that would help the panel.
Yes, I think it
In
probably
writing.
would. Yeah.
If I
Yeah.
could
please.
Yeah.
just also expand on that to say that there will be some homeowners who probably don't qualify for income support, but if they don't pay tax and if they own a house and they've got a State Jersey pension, that's their only income, they will not pay tax. If they don't pay tax, they'll be eligible for the Pension Plus scheme. They'll be eligible for cold weather bonuses. They'll be eligible for other things as well. Yeah. So those things they can be applied for separately. There's kind of parallel schemes within income support, so income support people get them as well. But there are some of these things flow across into other pensioners who aren't on income support but don't pay tax. So that's quite a nice smooth kind of edge on those.
And of course, from next year, if the budget is approved, it's the intention that more pensioners will be eligible for Pension Plus. That also unlocks the health access scheme for those pensioners as well, so the cheaper GP visits, which is really important.
It would be really good to get some modelling for different types of households, and we've asked lots of questions about the minimum income standard, so I'm not sure if it's part of that and we're still waiting for it, but if you can provide in the shorter term some modelling of what is already available, I think
it is
that
quite
would
different
help
because
us.
the minimum income standards will be an income standard about the amount of money, whereas I think the modelling that we're talking about here is what people are should be expecting to receive right here, right now in different scenarios. That's really important to me as well, because part of the things that we've been doing communications wise is trying to kind of myth bust around access to benefits. And I mean, I had a constituent come in to me, she actually had a question about tax, and as soon as I looked at her tax return, I said, do you realise that you'd be eligible for income support? Again, this was a homeowner pensioner, and she hadn't realised that she would be eligible, and she went in, she sorted out her claim, and then the next time she came in to see me, she told me how happy she was that you know she'd received that. So I am really aware that having scenarios like that are incredibly useful.
Thank you.
Thank you. I understand that public consultation is expected at the end of 2025 or early 2026 to decide whether to introduce the legislation for this. Has any consultation already been undertaken with employers to ensure that they're fully aware of the proposed changes?
So that's what the part of the project that we're starting. If the budget's approved, we'll be able to start that work. It is really important, as I said, this is going to be a complex piece of work, and we're going to need to take people on the journey with us. It is my intention that part of the objective of this is to help employers as well, because I'm sure that there are a number of employers out there that would like to be providing the benefit of a pension to their employees, but don't feel that it's accessible to them because there might be a small employer, for example. So that is very much part of the work that's planned for next year, is to start that consultation process. Again, so that we can talk about the benefits. We talk a lot about, the need to attract and retain talented people to the island. Part of the thing that those people will want to ensure is that they're able to save for their future, and that they're going to be looked after when they become pensioners as well. So I do see this as a positive thing for employers if they currently aren't able to offer a pension. It brings them up to the standard of other employers as to what they will be able to offer.
Thank you. And finally, what's the timeline for the implementation of this scheme? Do you have a timeline? It's probably difficult if you haven't had the consultation yet.
It's but also we will be dependent on legislation and things like that. So I'm just trying to think through in my head. What I don't want to do is promise a timeline right now when the scoping work needs to be done.
I'm going to skip some questions.
Yes,
Sorry, we're just looking at the question plan, noting the time, and I think I'd like to move on. Do you have any final ones that you'd like to address in this section? If you're happy for me to move on, we can always go back.
I'm happy for you to move on, yeah.
Thank you. I'd like to talk about the section of this funding that addresses the disability strategy. Could you outline some of the projects in this section that would be delivered if the funding is awarded?
So again, the outcome that I want to achieve is making the delivery of the disability strategy kind of quicker than it would have been otherwise. I do have the Disability and Inclusion Advisory Group, and we also think that it is incredibly important that we hear from people with lived experience. So it would be that group and those people that I will be wanting to engage with when scoping how that money is spent. But again, and I can see Sophie's wanting to come in.
No, it's just there are some things that we know at the moment that we're actively looking at, sort of trying to improve the transition for young people from with a learning disability, for example, from one service into adult services, and that's something where we know that we really want to be able to do more in this space and accelerate areas. Also looking at things like the Accessible Venues programme, we think with this additional funding we can sort of achieve more quicker with some extra funding. So there's a lot which isn't necessarily new things, but it's being able to try and get more delivery done, because there's lots of really important areas.
It was quite frustrating, I think, for both me and I think the Disability and Inclusion Advisory Group, that we had a disability strategy. We had a team, so we had funding for a team, but we didn't have funding to undertake any of the work necessarily. So that's why I thought it was important to get some funding in, so that now we can get some real impetus behind some of these projects.
Okay, and the project, so I'm looking at the report that was published, I think, on the 6th of October, and 3 of the poorly scoring actions were highlighted: the Preparing for Adulthood Transition Pathway, Appointment Accessibility for Disabled Islanders, and St Helier Road Crossing Accessibility. Are there any other... So the full action plan wasn't published. I think, first of all, could we please have that?
Yes,
if that's possible. And can you say, are those the only 3 actions that need more work, or are there others that you can tell us about now that this funding will help to address?
There's always more actions that need more work in this space. Those are 3 priorities, as Sophie said. Specifically, the pathway transitions to adulthood is something that we're working on across government, and that's a real priority.
Are they the 3 kind of top most important priorities of the outstanding actions?
At the moment, those were the ones that were highlighted by the Disability and Inclusion team. I have a meeting of the Disability and Inclusion Advisory Group coming up in November as well. I always think it's really good to check in on priorities with that group. But also we have I've forgotten what they are, our panel of people with disabilities.
Our lived experience.
With lived experience.
We do want to enhance,
Sure.
do even more engagement in that space.
Thank you. But just to go back to those 3 items, and you've said, again, they were highlighted. Are they highlighted as the 3 most important? Are they the 3 least costly? Are they the 3 easiest to achieve? Like, what criteria made this report highlight those 3?
That it would have been based on the discussions that were had with the Disability and Inclusion Advisory Group, as well as those people with lived experience. The reason why I'm being careful around saying that they're the top priorities is that because we're dealing with such a complex and broad space, the priority for some areas is going to be different to the priority for others.
Okay, I understand.
I think depending on who you speak to, their priorities will be different. As a government, we know that we've got work that needs to be done across departments around the transitions to adulthood, because we don't want people falling into a gap when they're transitioning from children's services through to adult services.
Okay.
And that's really important. You know that I like to focus on things so that we get things done, rather than do like the scattergun approach of doing all sorts at once. So that's where my priority is at the moment as a minister, to ensure that we've got some real drive and impetus behind that piece of work.
Yeah. Is it possible, when you can get that documentation to us, that there is some kind of indication in there of what is a priority in terms of importance, wherever possible, what would be the easiest to achieve, and the cost for each thing, so that we could analyse that?
Yes, we had a presentation done at the last advisory group meeting, which I think would be helpful to the panel. I'm also really happy to arrange a briefing for the panel from the Disability and Inclusion team.
Thank you.
You know, they're a great team with a lot of expertise. I know that we had Ant doing his Ant talk to States members very recently. But again, we're really keen to get information out there about what the team are doing. And I will give a plug while I can to the Embrace Our Difference event happening in December as well, and encourage states members to attend that.
Okay, thank you. And what was the overall feeling of that group in terms of funding that had been allocated in the past and this funding that is going to be allocated? Are they? What was the feeling in that group?
I think there was a level of frustration in the group, it's fair to say, around being able to get things done and go far enough as fast as you'd like to. Obviously, budget discussions I couldn't discuss with the group. That I was hoping to get this funding. I was able to tell them about the what we have in the budget at the last meeting. They were really pleased that I'd shown that this is a priority through having funding allocated in the budget. So I think that really sends out a strong message, and I hope that states members will support that.
Thank you. And in terms of going back to the original question, Minister, about inequity in society, did you take a disability sensitive approach to the budget overall, and indeed did the Council of Ministers?
I always try and take a disability and inclusion sensitive approach to all of the work that I do. That's the voice that I would bring to the table, and I think we go back to process. I think we've all got our parts to play, haven't we? And that's certainly something that I would see as my role in this ministerial role, to bring that voice to the table around discussions.
Thank you. And we note from recent media reports that there is some conflict between the carer benefits that households that have people with a disability within their household and the pension, that they can't be paid at the same time. Can you comment on whether that is something that you feel able to change, and would there be scope within this current budget to address that?
So obviously I can't comment on specific cases, that would be inappropriate, but what I can do is explain a bit more about how the current legislation works.
Can I just make a note about time? I can feel my vice chair getting fidgety next to me, and we do have a lot of questions.
So home carers allowance is a working age benefit from the Social Security Fund. And obviously the state pension is a pension age benefit from the Social Security Fund. So the way that the legislation works is that once you claim your pension, you're no longer eligible for working age benefits. A change was made in relation to home carers allowance, which I think was done with really good intention, to ensure that if somebody reached pension age when they are already claiming home carers allowance but would end up worse off because they didn't have their full pension entitlement, so switching from home carers allowance to a pension would make them worse off. This is the only benefit where there is the flexibility to choose to take home carers allowance rather than the state's pension. So by way of example of how that might work in another scenario, if, for example, you are on long-term incapacity allowance, you wouldn't have that option, but long-term incapacity allowance would cease when you take your pension. I think in the States, when I got asked about something similar, I talked about the need to take a holistic approach to benefits. So I had a really good discussion with Deputy Miles just a few weeks ago, who talked to me about the fact that, so in an example where you've got an adult child that is dependent and requiring care, that adult child is eligible in their own right for income support. So there's different income, and this is where scenarios will help in relation
Can
to
I just
that.
Can I just refocus? So going back to the pension and the home carers allowance not being able to be paid at the same time, the panel is aware of it's a UK report called the Scope Disability Price Tag that's very recently been published, and that states that households where there is a disabled person living within a person with disability within the household face additional costs per month of over £1,095 just to live at the same basic level as people without disabilities. Can you comment on this evidence, Minister, in the light of
so the
our
home
benefit
carers
system?
allowance isn't there to deal with those costs. That's where we've got the income support components that are there to deal with those additional costs. So where you've got somebody with a disability who's unable to work, for example, and receiving income support, then you would have different components of income support which are there to help with those additional costs. The home carers allowance is the working age benefit that is available. It's like the equivalent to parental benefit for when you're not working because you're taking your parental leave. Does that make sense? So that's there for somebody who is unable to work full time, although you can work up to 15 hours a week. With home carers allowance. That's the purpose of that benefit. The additional costs element is what's funded via the income support components, things like personal care benefits. We've obviously got the carers allowance within income support as well. And we've got the ancillary care costs component and personal care components of up to £198 a week. So by the time you add up all of those components, because I was aware of that report as well, and got asked about it a few weeks ago, when you add up those components together, it does equate to that additional cost as outlined in that report.
Can I just clarify then? Are you planning to make any changes to the overlapping benefits order to deal with the issues that have been raised?
I think that the issues that have been raised have been conflated and not necessarily understood appropriately. If I was to change the overlapping benefits order, would we then, for example, enable somebody to claim STIA at the same time as parental leave? So it's a wider issue. So than just home carers allowance. So would we apply the same ruling to all working age benefits? It's something I'd be keen to understand the panel's view on as well.
Could you not just make the home carers allowance a general, not just a working age benefit, but just extend the criteria?
That would be a fundamental change to the whole social security system. So there
Well,
are...
Guernsey has done it.
So because obviously this came up in media, I've asked officers what would happen if we implemented the Guernsey system here. The people would be worse off under the Guernsey system than they are currently now under the Jersey system. My understanding is, and Sue can speak to the technicality.
Can I just say, in terms of worse off, the point was that the Guernsey government doesn't provide any support for home care in Jersey, in Guernsey, yeah? So the long-term care scheme in Jersey was developed after the Guernsey scheme. So we learnt from some of the things that Guernsey didn't do. So what Guernsey did, Guernsey were ahead of Jersey, and Guernsey created a long-term care scheme that supported the cost of residential care, moving into a care home, yeah? And they did that at the time to address a specific issue in Guernsey. Jersey came to the table quite a lot later, but it had the benefit to look around more generally, look at what the UK was looking at the time, and was able to produce a scheme, which is what we've got today, which covers both the cost of care in a care home and the cost of care at home. Yeah, so the Jersey government has got a scheme that covers it very consistently and methodically covers the cost of care for adults being looked after at home. That scheme doesn't exist. That's why the minister's saying you don't really want the Guernsey system. It's got gaps in it which we've filled in Jersey. The gap around it's true that Guernsey people living in Guernsey can claim a equivalent of a home carers allowance. It's not part of their social security system. It's a means tested benefit. It comes through a different funding route, yeah, and you'd probably want to do that in Jersey if you were going to do it in Jersey. And it's true that you can claim that and claim your old age pension in Guernsey at the same time. It's also means tested.
It's the
just
same
a different benefit.
It's the same as claiming income support at the same time as your pension, if that makes sense.
But
So we have those types of provisions here already.
So, Minister, am I reading it correctly that you do not intend and do not wish to make any changes to the current system with regard to those overlapping benefits, the particular ones that have been raised?
I don't think it would be the right thing to do. I think we need to be really careful to understand the problem it is that needs to be resolved, and then the right solution to that problem.
Even though the relevant costs are very, very small.
The relevant
The relevant costs of doing
on
that.
what basis are you
making
suggesting that?
the figures that have been quoted?
But those figures are incorrect.
Okay. So you will provide, you would be happy to
can-
provide us with figures of what that would actually cost were
Yeah.
it to happen?
Yes, and also you need to be careful about what the definition of a carer is, because at some point in our lives, I think all of us are going to undertake caring responsibilities. So we need to make sure that the right level of support is available to people at the times that they are undertaking that responsibility, so that they do feel valued. Changing the legislation in respect to overlapping benefits, I don't think would meet that aim.
Is the wider issue not precisely the one you've just identified, which is that we have not traditionally paid and appreciated the paid work value of work in caring, and that this would begin to address one of the most obvious deficits in that failure to compensate individuals for caring work that saves the state a lot of money?
When you say failure to compensate, I think again we need to outline what support is available, because home carers allowance isn't the only avenue for financial support for people caring. And also, I really want to make this point. What we must do is make sure that the person receiving care is right at the forefront and centre of this, where people have the capacity to make decisions themselves. We need to be empowering people to make those decisions themselves as well. So this is a complex area. It might appear on the surface of it that changing the order in relation to overlapping benefits would appear simple. What I'm saying is it isn't that simple, and I don't believe that it would resolve the issues that I think the panel are concerned about.
And just finally, to pick up on the very good point that my vice chair just raised around valuing care, and I personally don't feel that we have enough of an understanding of what care happens in our island. It's not measured in the same way that we measure other elements of productivity. It's not included in our GDP, for example. Do you feel that we actually need to do some work to understand care and measure the value of it to the economy?
Yeah, as I just said, I think at some points in our lives we're all going to find ourselves in a position where we are likely to be a carer, whether that be for young children or our elderly, and being cared. Yes. So this is exactly why there isn't a silver bullet of changing the overlapping benefits rule. That, to my mind, might appear to be a simple thing to do, but isn't going to provide the level of reassurance that I think that you want.
Okay.
And we'd need to look then at the whole social security system and whether we think that other benefits should be able to overlap. So, like I said, for example, short-term incapacity allowance and parental benefit.
What you're saying is that when a person transitions from being an employed person to a pensioner, he is not actually worse off as a result of that?
Yes, the way that we calculate pensions these days has changed a few years ago. So the pension rate is probably a couple of pounds more than the working age benefit rate at the minute. But in essence, yes, the Social Security Fund is set up to collect money from workers and their employers, and it's set up to provide insurance-based benefits to workers at times when they don't work. So they don't work because they're old. We don't require people to work when they're old. And it also provides benefit, the same type of benefit to people who are caring for a child, caring for somebody else, sick themselves, or long-term sick, and so on. So we have a worker compensation scheme which includes an old age pension. And what was the overlapping benefits order, being technical about it, is just stopping you from being able to claim 2 worker benefits at the same time, because that doesn't make it. The scheme is set up to provide people with one benefit when they need something, and when they got all of one thing, they don't get any more of the same thing.
But I do want to give assurance that that's also then where the income support system steps in.
Absolutely, yeah.
So, for example, the situation that I discussed with Deputy Mars the other day was in relation to adult children living in the home not currently being eligible for the rental component of income support. That's something that I've undertaken with Deputy Mars and said to her that I am happy to look at changing, because I think that is, when we're talking about things that, and I'd hope that the panel know by now that I do look for solutions to things, and where I can find solutions that I think that can be changed in short order to make a real difference to people's lives, I will do that. And that's my intention with that accommodation, with that rental component. In relation to income support household, because when it's an adult child living within a household, they are an income support household in their own right, which again is really important, because it is important that that person is seen at the centre of that.
Thank you. Okay, thank you for your answers. We're going to move on now to talk about the ring fence funds, and Deputy Ranef will start this one.
If I could kick off with the long-term care fund, you've instigated an internal review, I believe, of the long-term care fund. Could you say what that review is designed to accomplish?
So I'm very aware of the state of the fund at the moment, and my Treasury colleagues will remind me that we need to look at ways of bringing more money into the fund. What I was quite clear with officers around is that if we're going to do that, we need to make sure that we're getting the best value for money out of what we're providing from the fund. So that was the intention of me asking for that internal review, to check that we are being as efficient and effective as possible in the way that we're spending that money, so that we can ensure that we're providing the best value possible to Islanders.
So it's designed to cover whether the fund is working efficiently. I think the question was raised about whether contributions would have to rise because of the rising cost of care and the rising uptake, presumably, of care.
Yeah.
So, and 1% was measured. Is that was mentioned? Is that explicitly a part of the review to measure, to try and ascertain whether or not contributions need to rise?
That would be part of the work that actuaries would do.
That is part of
Sorry, but it is part of that review, so that we can look at the value that we're getting out of that fund. What I want to feel comfort of is if there's going to be any rise in contributions to long-term care, that we're assured that that's going to provide the type of care in the most cost-effective way possible. So I need any form of future rise justified to me, and that was the reason why I asked for that review to be undertaken.
So the review will not report until, I believe, the next government, or will it be, I'm getting a nod there, so it'll be the next government that this will report to. And what guarantees do we have that any government will want to carry on that work?
I think any government is going to have to think very, very seriously about a long-term care fund and what the future of that fund is. It's a young fund compared to the Social Security Fund, so we need to look seriously at what it's delivering, what it's able to deliver, what our expectations are out of that fund, and then how we meet those expectations as well.
So it's essentially a piece of work politically neutral in your mind? because it was scoping out options.
Yes.
Okay. Do you want to move on to the health insurance?
Yeah. Can we move to the health insurance fund? And the budget shows that the closing balance of the health insurance fund moves from 92 million in 2026 down to 61 million in 2029. Is that a matter of concern?
As I've said before to the panel, I think we need to look at the health insurance fund in the context of health funding as a whole. I firmly believe that the expenditure that's coming out of the health insurance fund is expenditure that the community wants to see being made. I believe that the community values the benefits that are put into our GP service to make GPs more affordable and free for children. I believe that our community values the expenditure that's been spent on things like the leg wound dressing scheme as well. So I feel that we're expending the money in the health insurance fund for the things that the community would want us to spend that money on.
Is the falling away of the value of concern?
Like I said, I think that we need to have a look at health funding as a whole. Health funding as a whole is of concern. We need to make sure that there are funds available to provide the health services that our community desires and deserves. That is a piece
Minister,
of work.
I'm sorry, but you're not answering the question. The question is the falling off in value of the fund a concern?
I think any expenditure is always a concern. Like I said, and I will reiterate this, the Health Minister is undertaking a piece of work to look at health funding as a whole. I think that the Health Insurance Fund is a part of that, an important part of that jigsaw. I would be more concerned if we weren't spending money in the Health Insurance Fund and that people couldn't afford to go to the GP.
Of course, but you're still not answering my question. Is it a matter of concern to you that the closing balance in the fund is diminishing to a very considerable extent between 2026 and 2029? Is it a concern?
Public finances as a whole are a concern to me. We need to make sure that we've got enough money within our public finances to do the things that we need to do.
So it is a concern.
That is why I am working with the Health Minister and supporting the work that he is doing to look at health budgets as a whole so that we can be assured that our community can receive the health care that it needs and wants.
The corollary of the figures that Deputy Balash has mentioned is that the health insurance fund will run out if no other action is taken, and those things that you have mentioned that you think the public want will therefore not be fundable from the health insurance fund. Is one of your considered options that the health insurance fund should be replaced with some other funding mechanism for those things?
I think it's been quite clear in some of the work that's been undertaken by the Health Minister, and we've discussed as well about whether the remit for the Health Insurance Fund should be transferred over to the Health Minister, whether we should have one single health fund for the island. We need to make sure that our health service provision works across both primary, secondary care, as well as, you know, the pharmaceutical services that we provide. I think fixating on the level of money in the health insurance fund on its own is not particularly helpful, because we've got a far bigger issue that we need to tackle as an island, which is around how we make sure that we've got the most efficient, effective health service that's working together and working across primary and secondary care. That's why the boards that are being set up by the Health Minister are so important as well, because that brings representation from both primary, secondary care, and obviously the pharmacies and other support organisations around the same table, so that we can avoid duplication, so that we can make sure that we're working together, so that we can get our IT systems sorted out.
I get the overall point, but we're talking about ring-fenced funds, and the Jersey's pursued a particular model with ring-fenced funds, one of which is running out. Is it your intention, is it your view that we should move away from that model of ring-fenced funds for the things that are covered by the health insurance fund?
I think I would want to form a view once I've seen the work that the Health Minister is wanting to complete, because I think at the end of the day, again, and I'm at risk of repeating myself, we need to focus on outcomes, and whatever model is going to achieve the best outcomes for islanders.
I mean, something substantial is happening in relation to the health insurance fund. The closing balance in 2019 was about £100 million. It was about £100 million in 2020, 2021, 2022, 2023. And now in this budget, we see it dropping down to 90 million, 83 million, 72 million, 61 million. So something drastic is happening to the health insurance fund. Why is that?
I think one of the answers is that we're spending money on things that the community needs. So, and a lot of this is around decisions of the Assembly, and good decisions of the Assembly. Things like funding the wound dressing scheme, for example, was additional money from the health insurance fund. Things like providing free GP visits for children was expenditure out of the health insurance fund. So these are decisions that are being made as
They
an
may all be
Assembly
needed, Minister, but they've got to be paid for, haven't they?
Absolutely, and that is why I'm working with the Health Minister to ensure that we work on a holistic level across the health service, both primary and secondary care, to ensure that what we design for the future is a model that's most efficient, effective, and most importantly, providing what our community needs out of our health services, so that we all see the outcomes.
It's not unfair to say, is it, that this work has been going on for 2 to 3 years at least? And the Health Minister gave us the impression when he spoke to us about this topic that the work was at a fairly embryonic stage. It's quite a long way to go. Would you agree with that?
We're talking about very serious things. We're talking about the health service that is building a health service that is fit for the future of the island. It is a piece of work being led by the Health Minister. Myself and the Treasury Minister meet with the Health Minister on a regular basis. This is being taken extremely seriously, but it is important that it's done properly. And that we do not lose sight of what we should be doing, which is putting the outcomes for islanders first, rather than fixating on one particular fund or another, or specific models of funding. We need to work out what that good health service looks like. We know that we've got funding in the budget, for example, for digital services in health. That's incredibly important. We're doing an important piece of work to enable pharmacies to access EMIS, for example. All of those things as well will lead to possible savings in the future.
Okay.
Because we don't have joined up IT systems at the moment.
So, Minister, just to reflect on the question asked, are you concerned? And to slightly rephrase, do you understand why some members are concerned about this?
I understand why members are concerned. Members are concerned around funding for health as a whole. I'm concerned about future funding for health as a whole as well. I want to see us in a place where we've got that unified health system. We know that things are working as efficiently and effectively as possible. We are making savings where we need to make savings, but we're also providing the services that we need.
Do you think there's a middle ground? between those who are maybe not concerned and those who are concerned? What's the middle ground?
I think everybody's concerned. It's our job to be concerned about these matters. We need to take them seriously. We need to think through things very carefully when we're looking at budgets. I think the health insurance fund is providing for islanders in a really good way at the moment. You know, we've got our pharmaceutical benefits. I could list all of the things that the
Sure,
HIF is.
but-
And what I wouldn't want to do is start saying that we should protect that fund balance by stopping some of those things. What we need to look at is how we fund things into the future, and we need to do that across health as a whole.
And is there a middle ground or an alternative plan of action?
An alternative plan of action to what?
Alternative to not putting as much money into the funds?
We need to look at our revenue, our taxation, everything like that. We have to look at, as government as a whole, at our budgets and where we're prioritising. The alternative to where we are at the moment is improving services. Like I say, that the piece of IT work is really important. The work that the health minister is doing on public health is really important as well. There's so many strands to this piece of work. We can't afford, I don't think, to look at the HIF in isolation of all of that.
Minister, the overall impression I'm getting is a considerable distaste for the notion of a ring-fenced fund to fund these commitments going forward. Is that fair?
I don't think that's fair. I've been quite clear to say that I don't have one single solution in my head. The piece of work is being undertaken by the health minister. Once I have the result of that piece of work, then I think that we can decide the best model for funding.
Following on from Deputy Renouf, the page 88 of the budget says the ring fencing also introduces barriers which can act against the best interests of the patient. How can those barriers act in the best not act in the best interests of the patient?
I think
the barriers are there for the patient, aren't they?
Well, that comes back down to what we were talking around the need for our whole health service to be able to work together efficiently and effectively. At the moment, we've got decision making that's made in relation to the HIF that's separate to decision making made in relation to the hospital. Things like, for example, being able to get to your GP for free for children can then cause savings within the health service. So when we're looking at the most efficient and effective way of providing services to islanders, I don't think we can afford to look at things in isolation. And part of those issues are things like IT and processes and things like that. So.
I will ask it then, because I think we are still on the subject to look at those closing balances that are predicted for the health insurance fund. And Minister, I totally appreciate you've talked about spending money on good things that islanders need right now, but to look at those figures, the spending can only continue at that rate until 2035, and there's nothing in there. Now, that's the reality of it, and that's the reality of a fund that you're currently responsible for, whether you are in future. I mean, how does that fit now in your current role? That's the outlook, and decisions aren't made quickly in the government of Jersey, are they? In the States Assembly, we know that. It's all well and good to say, yes, we've got to look at this, but that's a fund you're responsible for, and that's the outlook for it. How does that make you feel, I suppose, is my question right now.
Reality as a whole is that the cost of healthcare across the board is becoming more and more expensive. You know, the cost of pharmaceuticals, things beyond our control, which is why we really do need to complete the piece of work looking at that whole health system. And that is where my focus is on. We need to focus on what the outcomes are going to be for islanders, and then the best way of delivering those outcomes. At the moment, we know that fragmented IT systems, fragmented decision making gets in the way of the best outcomes. We know it's inefficient. So if changing the current models and methods of funding can lead to a more efficient process that is going to enable us to deliver more things for less money, then that, of course, is where we should be heading.
Thank you. I'm just reflecting on that. How likely is it that these improvements, say in the health, the digital and efficiencies, like how likely is it that those things are going to deliver necessary savings so that this fund isn't going to be diminished? Or will there need to be other revenue raising measures?
I think that, so we can talk about one piece of work that's prioritised in our area. I'm just thinking about the piece of IT work with the pharmacies. I don't know if you want to talk a bit about that.
Yes,
Sophie.
I suppose that's on a sort of small scale basis. That's
But it's a
about
good
trying
example
to,
of efficiency.
trying to make, at the moment, pharmacies don't have access to patients' medical data. So actually pharmacists have to spend quite a lot of their time on the phone back to GP surgeries checking, does this look right? Where there's any sort of queries. By giving that direct access, pharmacies are really, it can actually free up their time to be focusing on being able to make those calls. That is what they're trained for, being able to look at things. So we're really keen to make sure we can support pharmacies by having this access so that they can do what they should be doing rather than a lot of time taking up with the admin of back and forth and navigating GP surgery admin as well. It's in no one's interests either side to be doing that. So that's a piece of work that we're really trying to kind of accelerate to enable better, smoother working.
And I thank you. And I think every government aims to make efficiencies, but it reaches a point of there's an end point to that, isn't it? There's only so many efficiencies you can make, and if health costs keep rising, will we need to introduce revenue raising measures, or will we go down the route of the UK and see the erosion of services? Like what do you think? Which road will we go down, or which road do you think we should go down?
I mean, I think you know me well enough to know that I wouldn't want to see the erosion of services. Revenue raising measures will mean different things to different people, and it will depend on your politics as well. My own view is as health services should be free at the point of need. That's quite clear in my manifesto. But we need to look at the revenue that we have as a government as a whole and how we prioritise that revenue. I think that most people would quite rightly see health as a priority, which is why we've got the budget that we've got ahead of us right now. It's why we are choosing to prioritise health within this budget as well. Of course, there are efficiencies that each department can and should be making. We need to balance that. I certainly wouldn't want to see services diminishing.
Can I round off the health insurance fund questioning by putting this to you, Minister? The health insurance fund has served the island by subsidising primary care for very nearly 60 years, since 1967 when it was introduced. For the very first time, the fund looks as if it's poised to run out, as Deputy has said, in 2034, 2035. I don't really get the impression that you are concerned about this, because you take the view that it's all going to be sorted out at some time in the future in relation to the general funding of healthcare. Is that a fair assessment?
No, that's not a fair assessment. I've made it quite clear that I'm working closely with the Health Minister, supporting the work that he and his team are doing in relation to health funding as a whole. We are taking this incredibly seriously. The costs of providing healthcare have risen over the years, so we're not now in the same position as we were when perhaps the funds were established. It is always really important to take stock at points in time and recognise that what may have been right previously may not be the right solution for the island now. We can't get stuck in the past. We've got to move towards the future, and that future needs to be one where we've got a unified health service that is operating in the best interests of islanders.
Yes. Yes.
Perhaps from one fixation to another, a major feature of the budget is the reduction in the state's annual grant to the Social Security Fund in order to fund health and childcare and other things. Earlier in the week, you published a letter from the actuaries, which you said gave you confidence that the Social Security Fund could cope with the reduction in the state's grant. And I want to start by asking some questions about that. When you wrote to the actuaries, you gave them some assumptions, one of which was to assume an increased rate of return compared to previous assumptions, an increased rate of return of 1%. Can I ask what was the basis for that?
I think I was asked the same question in the States just the other day. And I did refer to advice that I've had from Treasury colleagues as well as my own officers. I've brought Andy along and Sue so that we can give the technical answers that...
I asked the question again because I want to ask a follow-up question related to that, which is the Treasury obviously have a desire to balance the budget. They have an interest in making sure that money is made available. Was it appropriate to rely on Treasury advice about assumptions when they had a desire to ensure that the budget would be balanced?
I didn't rely on Treasury advice. That's one of the reasons why I went to the actuaries as well, to get an independent view. In addition to Treasury advice, I also get advice from my own officers that provide impartial advice that isn't from the Treasury. The scenarios were a range of scenarios being asked that present likely scenarios for the future. And in my view were sensible and measured.
In the Assembly, you said that the 1% increase was something which you were reassured by Treasury, which was realistic. My point is, Treasury were essentially conflicted.
Well, Treasury were providing advice based on the previous performance of the fund. That's factual and not something that can be point of conflict.
The other point about that is that you mentioned the point that the Social Security Fund had outperformed in the past and had grown, and that the investment performance had improved, had been stronger than in the past, and that was another justification for increasing that expected rate of return. The figures that have been quoted are that it has grown by 400. The Chief Minister said this, and in fact, that 450 million over the last 3 years, but which is a 20% increase. But inflation has been 20% in that time. So has there actually been a real increase in the value of the Social Security Fund over that period?
I think I would need to go to Andy to answer the...
So I don't have those detailed calculations you described, but my recollection is that the fund has close to maintained itself in real value over that period.
It's maintained itself, it hasn't grown.
So it's grown in nominal terms, it has got bigger, and I think it's useful to remind ourselves that during that period we've seen particularly high levels of inflation, which when talking about a fund which works in actuarial time periods, short periods where inflation is particularly high, if you can still achieve investment returns which keep up with inflation, that's quite good.
But it stood still, essentially.
So it has, in real terms, it's more or less stood still. But also during that period, that 4-year period still included some of the impacts of COVID as well. And as you will all remember, not the state's grant wasn't paid in full each year. And obviously the formula for the funding of the Social Security Fund was based on contributions from employers, employees, and a state's grant being paid in. So during those periods, there was a need to use some of the investment returns in the Social Security funds, in the wider sense, Social Security funds and the Reserve Fund, to make sure that pensions could continue to be paid. And that was done, that was approved through multiple budgets, assemblies approving that. as a way of helping manage that.
So
So with all of those things put together, maintaining it in real terms could be seen as a good thing that it hasn't reduced in real terms.
I
And
mean,
it is forecast to
entirely accepting that it's a good performance to be able to maintain the value of the fund in a time of high inflation. Nonetheless, the fund has actually stood still in real terms. And that gives rise to the question of whether it is reasonable or sensible to ask the actuary to assume that there's going to be an additional 1% real improvement in the future.
Oh, I see. I understand your question. So yes. If you look at the investment returns during the period that you're talking about, which isn't the balance in the fund due to those other factors I just described, the investment return was more than inflation. I don't think I have the 4-year period you're referring to, but if we look back for the 5-year period up to the end of 2024, the actual return, the average annual return on the fund was 9.3%. The target return is RPI plus 3%, which would be 7.3%, so it exceeded its target, which in itself is higher than inflation. So in the investment returns, the evidence that the investment returns will be better is strong. The fund balance itself has other factors that have meant that it's not increased by that same level of the total investment return.
The actuary has been told to assume an extra 1%. Has the actuary been asked whether this is a reasonable assumption to make?
Can I make a point about the way in which the actuary does the assumptions, and also make a point about how the Treasury kind of measure things and how the actuary measures things? So we've just had a Treasury representative give you a figure in relation to RPI, and your figures are also, you're talking about in real terms against RPI, yeah? But in reality, the Social Security Fund, as I said before, is about a workers' insurance scheme, and it's based very, very heavily on wages, yeah? And therefore, the actuary and Social Security Department will measure things against wage increases, yeah? Which is just slightly different and will be less than the inflation, considering the very high peaks of inflation recently, yeah? But the actuary, if you look back at the 2021 report that was published well before all this, you'll see there's a central scenario of wages plus 2% for investment returns. And then there are variant scenarios of so wages plus 2, and then we do a variance plus 3 and then minus 1, which gives so plus or minus 3 to the plus 2, so I'm getting confused. So we end up with a wages minus 1, wages plus 2, wages plus 5. That's, if you look and see the published report, you'll see those 3 scenarios being set out, yeah? The wages plus 2 is the one which is a central scenario, which is the one that we use the most. But when we then look at the investment returns, we see that wages plus 2 is under what has been a consistent average performance. And therefore, to go from wages plus 2 to wages plus 3 is a perfectly sensible thing to do, given the historic evidence that we have in front of us. The Minister gets that evidence from the Treasury because the Treasury is responsible for the investment function within the fund.
The Minister, you've written a letter to the panel explaining that you will be asking the actuaries to give you further advice, for which we're grateful. Could you outline what further advice you are going to be seeking from the actuaries?
So I was quite confident from the advice that I received that the time-limited reduction in the state's grant doesn't have a material impact on the life of the fund and the fund itself. I sensed from the conversations that I'd had with other members in the panel that the panel wished to have more reassurance. So we've asked the actuaries to come back with just modelling that one-off reduction so that we can see the actual effect of what we're looking at in this budget. There were some other questions, and off the top of my head,
Will you ask the actuaries to model different rates of return, not just the increased rate of return? The officer has just mentioned the standard 3 standard rates of return. Could you use those so that we had a variation, a range, I should say?
Was that,
Yes, we can do
yeah,
that. Yeah.
we can do that. Obviously, I'm happy. I'm happy to work with Scrutiny. This is an important process. It's really important that other members have the information that can give them as much confidence as possible about decisions being made. I'm also happy to have whatever briefings the panel or other states members want around these matters. I was confident and didn't need the actuaries to model the one-off change, which is why I asked, knowing that there would need to be decisions made in the future. I asked about more of a future scenario, but I'm keen to make sure that the panel and other states members feel as confident as possible ahead of that budget debate.
I think the point is that the tables which you have shared with the panel and now published make it very clear that the state of the future state of the fund is highly sensitive to those assumed rates of return, and therefore, in fact, it's by far the dominant factor in affecting what state the future the fund arrives at as a result of these reductions. So it feels to me certainly essential that if we're to have confidence that those reductions in the grant are justified, that we consider a range of scenarios, because I do believe that the standard investment advice is that which future returns should not be based on past returns. You can't make those assumptions.
I'm happy, but we need to work with the best information that we've got to make decisions for this budget. I think that we've come to a good solution. Andy will know I provided Treasury with a lot of challenge in a number of meetings, which gave me confidence to agree the budget as it stands. I'm keen that both Scrutiny and other members are given the same opportunity to give the same type of challenge that I've given Treasury, and I'm more than happy to facilitate that.
So you will be putting those extra scenarios into the questions that you're going to ask of the actuaries, and we'll get those answers before the budget.
Yes, I can do that. I'm not personally sure what value that will have, but if that's something that will make you feel more assured, then I'm more than happy to do that.
Sorry.
Can I just, so in terms of officer advice, what was the plan B? So say officers had advised this is possible and Com had said, no, we don't want to touch these funds, but we want to fund these bids. What, in terms of advice, what was the plan B?
The other plans, and I think I'm just trying to recall whether there was, because I know that we had a States Members workshop around budgets as well, I think. So, I mean, we all have the stark realities, don't we? If the funding's not available, what are you going to cut? So we've got the things that we've been able to budget for, which are really crucial things in my view, things like emergency services, teachers' pay and conditions, and childcare costs. So the starting point would have been we'd have had none of those things, or you cut other services quite dramatically. We'd have ended up with a deficit in our health budgets.
You could have not increased personal tax allowances. It's not all about cuts.
Obviously, changes in taxation could have been considered. Again, it is up to any members. My own party's brought propositions to the states around changes in both contributions and personal taxation. Those particular propositions didn't get approved by this assembly, so we've got to work in line with what the appetite of the assembly is. I don't think that there was a broad appetite in the assembly to change taxation or contributions at this point in time. So we were working within those parameters. So we do what we do, and I think we've come to a good end point in relation to this budget, an end point that we are able to put money into incredibly important things. We have to put money into our residential childcare services. That is an absolute non-negotiable. And if it means that we are not putting the money into the state's grant as would have been previously planned, I think that is a good place to get to, because at the end of the day, I've been assured that this temporary measure doesn't have a long-term impact on the fund, but it will have a very real impact to our community in the coming years.
The Minister of Social Security has a conflict of duty in this area, doesn't she? Because on the one hand, the Minister wants to be a collegiate member of government and balance the books and so on. And on the other hand, the Minister has a duty to protect the Social Security Fund and protect the interests of pensioners and prospective pensioners. So it's a conflict. But my question to you is, you feel comfortable, do you, that you have reconciled that conflict of interest in the outcome to which you are a party?
Yes, I do, because at the forefront of my mind as well is intergenerational fairness. And as we can see from the advice provided by the actuaries, if you look at those, it's actually not pensioners of today that should be concerned. And I know that there's been a lot of misinformation around that for pensioners of today, and I think that's very unfortunate. It is planning for our children's generation and the generation that comes after that. Now, part of that planning has to be that we know that we've got a working age population living in the island, and part of that has to be around ensuring that those children that are growing up today have access to the services that they need so that they have a good working life, and they are able to enjoy their childhood as well, that we tackle the big issues of today, such as child poverty, and that they can see a future in this island, because if those children can't see a future in this island, then we won't have that working age population to pay into the Social Security Fund for the future.
But under almost all scenarios in the letter you sent us, it doesn't affect pensioners today, but the fund runs out. So it runs out more or less quickly according to the various assumptions that about population and so on. But that's the point. You have to balance things here. You're saying that the needs of the present trump the needs of the future, because you think there's a reasonable chance that we will still be able to meet those needs in the future.
I'm not saying that, and I think it's fair to say that even when the fund was established, there was always the tapering out of the fund. What we're talking about now is a really very healthy fund. We've got decision to make as a States Assembly. Do we think that taxpayers want us to continue putting money into a fund that has outperformed where we thought it would be now in terms of investment returns? Do the taxpayers want us to put taxpayers' money into that fund, or do they want us to put taxpayers' money into ensuring that our children's residential services are fit for purpose, into ensuring that we've got well-funded emergency services, so that we've got affordable childcare? All of those things are really important. So I don't think it's fair to say I'm putting the needs of today ahead of the needs of tomorrow.
All right. I'm grateful to the Minister for saying that she will consider these different scenarios when she talks to the actuaries, and we'll get that before the debate. Just to try and build on that reassurance, why doesn't the government publish investment accounts and actuarial reports for the Social Security Fund on an annual basis, which would give us greater visibility on the health of the funds?
I think an annual actuary.
Well,
Or
it's two different
investment and investment.
two different things. So the investment comes
okay.
under the Common Investment Fund, yeah? And there are regular reports on that, which Andy knows more about. In terms of the actuarial review, we currently have an actuarial review that's aligned to electoral cycles. So we're doing it every 4 years. It takes the Social Security Fund, it's a major undertaking. We always use independent actuaries.
Can I interrupt? I understand that an actuarial review is a big thing, but there could be actuarial reports published you've published a letter, which is effectively a report. Could there not be reports published on a more regular basis?
But
Which
I'm
would
not
be
quite
a
sure
snapshot,
what would be
or
in the
would be-
report. So,
Well, there
so
would
we
be-
do a review. The review takes a year to do. So, I mean, if you were doing it every year, you'd have to be always doing a review. We're doing it every 4 years to make sure every incoming government has good up-to-date information. And even then, we won't manage to get it. The one that we're going to do for the end of this year, we won't manage to get it published until probably January 2027. That's our current planning date. So I'm not quite sure what else you'd like to have in between
There's a midway
times.
house between a full actuarial
Yeah.
review.
I think that's down to the Social Security Minister at points to ask for advice, like I've done. So what you're suggesting isn't happening is something actually that we have done in relation to needing to get advice
Like an
and then
update
publish
on
it.
Yeah. Just an annual
So I think
report.
there needs to be a purpose for that update, because again, talk about effectiveness and efficiency. If you're doing it for the sake of it for no purpose, then that's not a very effective way.
I think the
to
purpose would
behave.
be, I mean, up until very, very recently, there was no question around this because nobody was suggesting, using the state's grant as a method of funding current spending. Now it is, and therefore might there not be a need to provide more reassurance on a more regular basis?
That's exactly why I've taken the action that I've taken over the summer in requesting the additional advice. That's exactly why next year we are asking for additional review work to be done, knowing that decisions and questions are being asked and decisions need to be made. So I think I am already doing what you're asking me to do.
Okay, and just to close off the point, the investment accounts, are those published, and if not, why not?
So the Social Security, the Social Security Fund and the Social Security Reserve Fund are both included in the annual report and accounts. So in the wider States of Jersey annual report and accounts, there is a specific narrative on the performance of the Social Security Reserve Fund in the accounts in terms of how it's done and what balance it is holding. So that is set out, and there is also a detailed note which goes through audit process of what the balances in the fund are. I think if I understand your question correctly, is that you're expressing that isn't enough detail on these funds. So I think it then comes to a question of, does more detail need to go into the annual report and accounts? It's already quite a lengthy document. It's 260 pages long. Do we really want to make it longer? Guernsey do, for example, include, I think, a set of detailed investment accounts which are almost as long as the rest of the accounts put together. And as the Minister said, there would be an overhead and cost to pulling that together, putting it through audit, etc. as well. So it is possible. What I think we have seen in recent years is that high-level report lets people know what has happened at the higher level, including details of what's going through the Common Investment Fund, which invests both the Social Security Reserve Fund and the Strategic Reserve. To get into more granular level, we have provided information, I believe, through FOIs or states questions, so it's not that information is all secret. What I think is probably a good point for us to take away is what level of information would be useful for people to get on a routine basis, which may be through the accounts or it may be through another method, say open data publishing, that would be useful for not just members but also for the public as well. So yeah, the short answer is we do very high level stuff.
That's a helpful
If we wanted
comment.
to do more, it's something that could be considered, but it's non-trivial, I suppose, to do it.
And I think, Minister, you've initiated a review with the government actuary outside of the actuarial cycle to look at the historical performance of the fund. We talked a little bit about the fund balance and the fact the fund balance is sitting at a high level. And for the fund to work as a pension fund, it doesn't need to be at that high level. Yeah? And the intention of previous ministers was to bring the fund up to have a good reserve in it, and for that reserve then to be used to help with the demographic bulge that we're currently seeing. So you would expect it to rise, to reach a plateau, which is kind of where we are at the minute, and probably to fall off again to a level that's more in line with the needs of a pension fund of the sort we've got. That's what this review, the Minister's second review, this one-off review is going to do. And that will be really important to offer up options for the future, for the next government to look at in terms of whether the fund balance should be reduced or not, and if it should be reduced, at what point. Talk about intergenerational fairness. You can use the fund to protect the contribution rate for quite a long time, probably, if that's what you wanted to do. There are options. There are lots and lots of options to be had. And again, the conversation just now also suggests that we can include in that review, perhaps not for the actuaries to do, but for the internal to do, as to kind of what level of public information should be available to people on a regular basis going forward. Having finished this phase of the fund has worked very well from the late 1990s up to now. It's done what it expected to do. This is a turning point, if you like, which we need to reflect on what the next generation needs and how we deal with that in the best possible way.
I've got one final question, but it may be better at the very end. If we've,
Is that on this?
yeah, well, no, general.
Okay. Is that on the
Wraps up
question?
things.
Okay, I have one place. You ask yours.
But I guess my reflection on the points that we've been making across this whole hearing, Minister, is that almost every question has been about extra spending. There are demands for spending mounting in health, in care, with caring, with disabilities and so on. We are taking money from this grant to the Social Security Fund to close the funding gap, but that only lasts, according to the budget proposition, for 4 years, and after that we will have to find other methods. Are we essentially reaching a turning point in Jersey's tax and spending model where we have a mismatch between what the public expect us to pay, expect to receive, and what we're prepared to pay?
That's a very politically charged question, isn't it? I think that as we come up to the election, that's going to be a very real election issue around public expectations and what we're willing to pay and how it's paid for. And I think we've all probably got different views around the table on that. I think it will be a matter for debate.
My question is, do you think we have reached the point where there is a fundamental gap between what we're gaining in tax and what we need to spend?
I think at the moment, and this comes down to the decisions made into the future around states grant and whether if we're going to continue. So if we do stop the reduction in the states grant, then there will then be gap that needs to be filled. You've quite rightly highlighted that. I am very clear in my manifesto about my taxation policy. I think other members are going to have to be very clear within their manifestos as we approach the election around how we intend to both collect revenue but also spend. But from my part, what I can say is I am very confident that my department is run efficiently and effectively. We're playing our part in respect of the savings targets. In fact, I think it's fair to say, and Sophie will correct me if I'm wrong, that the department's exceeding its savings targets.
I'm ahead of schedule, yeah.
So we've all got a different part to play. This obviously is a scrutiny hearing. You're questioning me as minister. I think that's quite a politically charged question and one that will play out in the election.
As minister, you just have hinted that you might think there's a case for extending the reduction in the grant.
I think that will be a question that's asked during the next budget discussions, which is why I've requested the information in advance from the actuaries, so that if that is indeed proposed, the states members at the time that are considering it have all of the correct information ahead of time to consider that question. at the end of the day, what we're talking about is where we spend general taxation. At the moment, we've got a model that we have a third into the Social Security Fund. A third of that is through general taxation. So the question is that model still fit for purpose? That's what I'm asking the actuaries, so that information is available ahead of the next budget.
I asked a very similar question of the Chief Minister in the other hearing, by the way, so in case you're feeling I'm singling you out.
Okay, any more questions on the funds? No. Okay, this has been a hearing of two halves, really, hasn't it? The kind of social issues and how you're addressing those, and then some questions on the funds. And I wanted to take us back to the beginning of the hearing, Minister, and you mentioned as one social issue in particular, and that was child poverty. And I would like to understand whether you feel this budget sufficiently addresses that problem, or whether we need to be more ambitious, say, in future budgets, in eradicating that problem, and what might that look like?
That's a big question for the end of the end.
3 minutes to answer it. So.
I think it would be very bold of me to say that this budget answers that problem. I'm seeking in what I do on a day-to-day basis to deal with issues such as child poverty. As I said earlier in the hearing, where I see issues that I think we can resolve in short order, I try and do that. I hope that the back to school bonus will be a welcome addition for families on low income. But we've still got a long way to go, and I will continue making that one of my priorities to work towards. And yeah,
what would it look like structurally if we were aiming to eradicate child poverty? In a fiscal sense, what would that look like in terms of the structure of our funds and taxes, and what might it look like?
That's one of the reasons why I wanted to undertake the minimum income standards piece of work, so that I can have a look at what that income standard looks like, and then look at what levers we've got that enable us to meet some of those needs. It troubles me that we've got children going to food banks while their parents are working. That's of real concern to me, and I'm keen to continue to work with organisations to understand what the key drivers are which are leading us to that outcome, so that we change that outcome. Well, quite clearly, we don't want to be in a situation where we've got a very wealthy island where we've got children who can't afford school uniform, whose parents can't afford school uniform, and who are needing to access a food bank. So for me, resolving that means understanding those root causes as to why that's happening in the first place, and then using the resources that we've got and the levers that we've got to do that.
And when might we get the information on the minimum income standards?
That piece of work's being led by the Minister for Sustainable Economic Development. Mm-hmm. My understanding is that a procurement process is now nearing completion, if it's not already completed.
Oh, so it's still quite early stages.
But the supplier has been chosen. So
okay.
And my understanding is that that's within their work plan to deliver, but the delivery date is still the same. Well, my understanding is I've not had an update that the delivery date has moved from mid next year.
Still middle of next year, yeah.
Middle of next year. Okay. Thank you. Does anybody have any final questions? Okay, well, thank you, Minister, very much for your answers over the 2-hour hearing. We really appreciate your time and the answers and the work that you and your team are doing.